Good evening, everyone, and welcome to part 4 of Dr. MC's series, Owning It, Caring for the Self and Others. I'm Maureen McCarthy, the president of the Friends of the School of Education at Salem State University, and we are and have been the proud sponsors of this event. Dr. Teresa Melito Connors received her undergraduate degree in theater studies from Emerson College, her master's degree in school counseling from Salem State University, a proud Viking, I might add, and her doctorate in educational leadership from Lesley University. Along the way, she has developed a very vast body of knowledge regarding the need and the ability to care for oneself. She is also the founder of Dr. MC's Self-Care Cabaret. Dr. MC understands the challenges of balancing all of life's responsibilities and the importance of making time for oneself. I am so pleased to be able to present Dr. Teresa Melito Connors.
Thank you so much, Maureen, for that beautiful introduction. And yes, I am very much a proud Viking. Salem State University is and always will be very special to me in my journey. My mom went to Salem State, and so it's a very special place. So thrilled to be back here. I can't believe it's part 4. Thank you. I know that there are some familiar faces watching right now, and hopefully some others that will join us either later or watch the recording. And I very much appreciate your time in joining me. So yeah, tonight we are going to talk about examining implicit or unconscious bias and microaggressions. But we're also going to tie it all back to self-care, because I can basically make anything relate back to self-care, because it's really the root of how we show up in the world, how you care for yourself, the consistent way, the foundational way that you take care of yourself so that you show up as the best version possible. So let's dive in. So if you haven't, just a little preview of the other sessions, they have all been recorded. So if you haven't seen them, you can get caught up on them. There was the first one back in October, which was about really evaluating our self-care routines and how to develop a routine. Then we talked about the intersection of trauma, resilience, and self-care. And then part 3, we did developing a growth mindset and what that looks like. And then of course tonight, you know why you're here. So very exciting. And those are available on the Salem State website. The link is actually just put into the chat. So make sure you share that if you'd like to access those previous recordings for more Dr. MC content. And I am monitoring the chat feature, so that's a great way for folks to communicate with me throughout the presentation. All right. Our first quote: embrace that it is normal for all human beings to have unconscious biases, and that those preferences and biases impact most, if not all, of the decisions we make, including those regarding people. Everybody has this. It's just a matter of figuring it out and how you deal with that once you understand that everyone has them. So we're going to do a little test. So I'm going to ask you a couple of questions. You can respond in the chat with me for your answers to kind of get us a little oriented. So true or false? Unconscious bias is a hidden preference or predisposition for or against something. True or false? True. Nice. Yeah, very good. That statement is the definition of bias. Though in common language, bias has a negative connotation because of its association with terms like prejudice or discrimination. Next one. What causes unconscious bias? Discrimination and prejudice, absence of training, bad influences, autopilot processing, or the absence of experience? Yeah, got some options there. Let's see, we got auto processing, all of the above, all A or D. All right. The answer is actually auto, although I think an argument could be made for all of the above, truthfully, but the answer is autopilot processing. Unconscious biases are the result of programmed guidelines and rules that the brain learns based on experience and uses for definitions that may or may not need or allow for deliberate consideration. So a couple more questions. Recent research indicates that the most fundamental need that human beings have is food, clothing, and shelter, belonging, safety, esteem, or maximizing one's potential. What do we think about here? And this is recent research. See a couple of belongings in the chat. Belonging. Yeah, that is correct. Originally, if we think back to like the hierarchy of needs, older research used to indicate that, you know, the food, clothing, and shelter was really at the basis. But now more recent research is indicating belonging. It's programmed into us as infants when we begin to realize our dependency on our parents for our physiological needs. So the need to belong. No, it's no secret to why DESE, the Department of Elementary and Secondary Education this year, in response to the pandemic, started promoting a sense of belonging as one part of their roadmap to remediation, or excuse me, acceleration, not remediation, as we move forward from the pandemic, because that sense of belonging is really showing up heavy. So great job. All right, last question. The percentage of information processed unconsciously by the human brain through experience-based rules is less than 10%, less than 50%, more than 75%, more than 90%, or more than 99%. So the percentage of information processed unconsciously by the brain. Now we get some 95%, D. It's actually E. It's more than 99%. The brain gets 11 million bits of information every minute and can deal with 40. So the remaining 99.9999999% of information gets processed unconsciously. So that's why when we think back to that first quote that I shared, everybody has this. And that's why, you know, we refer to it as unconscious bias. You don't even necessarily know how or why that's showing up for you. Yeah, that explains a lot of things. It really does. I was fascinated when I was doing some of this research to put together this presentation, because that's kind of, whoa. All right. So when one recognizes a bias, the thought should then be substituted with the new information that has been learned. Doing this on an ongoing basis takes mindfulness and self-regulation and commitment. So you have to be aware enough to how you're showing up in order to be able to do this work. So this is why it's really important, and this is how I tie self-care into this, because mindfulness is a big piece of self-care. If you have joined me for the other sessions, you've heard me say this before, this is your first session with me, you're going to hear me say it tonight, and we'll talk more about it as we work our way through the presentation. But mindfulness, self-regulation, and commitment, these are how we can do this work. All right, we're going to do a little self-care break. I have purposely woven some self-care practices throughout this presentation because this can be hard stuff. As we work our way through this presentation, feelings may come up, experiences may come up, and this topic can get a little heavy. So I want to make sure that we're taking care of ourselves throughout our time together this evening, and that we're making sure we're coming at this work from a place of calm. So I'm going to lead you through this exercise. It's one of my favorites. It's a very good grounding exercise. Also, if folks want, I can share some resources with you after the presentation, and I will include this slide in the resources. I'm just going to type that website into the chat if you would like to make a request for the reference sheet. It's drmcselfcare.com/resources. All right. So let's do this. I'm going to lead you through it. You're going to put your hands on different parts of your body. Will you repeat after me the sentence, just for now I am, and finish it off with the corresponding word on the right-hand side of the screen. We're also going to take big, beautiful, deep cleansing breaths as we do this. We're going to breathe in through our nose and a nice long exhale through the mouth. Pro tip, make your exhale longer than your inhale. That helps to activate your parasympathetic nervous system, which is your rest and digest response, which is the opposite of your fight or flight. I gave this presentation, not this presentation, I should say, it was a different one, but I used this exercise recently to a group of nurses, and the main director nurse emailed me today and told me she's been doing the extended exhale break, and she has been already feeling the benefits. And I thought that was so cool. So this is legitimate here. So I'd like you to sit up in your chair. I invite you to sit up on whatever you're sitting on right now. And I want you to feel your feet firmly planted into the ground beneath you. And I want you to feel your body supported by whatever it is you're sitting on. If you're on the couch, if you're on the bed, if you're on a chair. And just be here in this moment. You can close your eyes or lower your gaze if that's comfortable for you and safe to do so at this moment. And we're going to place our hands on our head, and we're going to take a big deep breath in through the nose and a long exhale. Just for now, I am connected. Move your hands to your eyes. Take a big deep breath in through the nose and a long exhale. Just for now, I am clear. Move your hands to the side of your face. Take a big deep breath in and a long exhale. Just for now, I am focused. Move your hands to your throat area. Take a big deep breath in and a long exhale. Just for now, I am wise. Move your hands to your shoulders. Big deep breath in and a long exhale. Just for now, I am relaxed. Move your hands to your heart. Take a big deep breath in. A long exhale. Just for now, I am grateful. Move your hands to your solar plexus, which is your upper belly area above your belly button. Take a big deep breath in and a long exhale. Just for now, I am calm. Move your hand to your abdomen, your lower belly area below your belly button. Take a big deep breath in. And a long exhale. Just for now, I am forgiving. And move your hands to your lap. Let's take one last deep breath in. And a long exhale. Just for now, I am peaceful. And when you're ready, you can blink your eyes open or lift your gaze. Such a great calming exercise. I always feel my level of stress come way down anytime I take a couple of moments to do that. So now let's keep going. So let's define our terminology. Implicit or unconscious bias refers to the attitudes or stereotypes that affect our understanding, actions, and decisions in an unconscious manner. Let's look at explicit bias. Refers to the attitudes or stereotypes that affect our understanding, actions, and decisions in a conscious manner. I apologize for the typo on the screen. And a microaggression, a statement, action, or incident regarded as an instance of indirect, subtle, or unintentional discrimination against members of a marginalized group such as racial or ethnic minority that implies they do not belong or are inferior, can be disguised as a compliment and often occur without any harm intended. It's very key to understand that when we talk about microaggressions, this is not unintended harm. It's usually not, again, disguised as a compliment. It's not, the person often doesn't understand the impact of what they're saying. We'll talk more about that. So microaggressions can be based on a lot of things. They can be based on socioeconomic status. They can be based on disabilities. They can be based on gender, including even just expression or identity, sexual orientation, race, ethnicity, nationality, religion, physical appearance, or age. There may even be more categories we could come up with when we think about microaggressions. And I'm sure we can all think of situations where we've either experienced it ourselves, we've said something that we didn't mean, or we've witnessed something that would fall into this category. So how is this different from prejudice or stereotype? Well, typically prejudice behavior is overt and is intended to cause harm. So that's the difference when we think about microaggressions. Remember, the intent of the microaggression, although the impact may be significant, the intent was not to cause harm. Whereas when we think about prejudice behavior, the intent is generally to cause harm. And when we think about stereotypes is a widely held but fixed and oversimplified image or idea of a particular type of person or thing. So that's also a little bit different as well. Not exactly the same as what we're going to talk about tonight. So we're going to do our first activity. I'm going to read a scenario to you, and you're going to come up with the answer. We're going to solve the following problem. A father and son were involved in a car accident in which the father was killed and the son was seriously injured. The father was pronounced dead at the scene of the accident, and his body was taken to a local morgue. The son was taken by ambulance to a nearby hospital and was immediately wheeled into an emergency operating room. A surgeon was called. Upon arrival and seeing the patient, the attending surgeon exclaimed, "Oh my God, it's my son. Can you explain this?" I'll give you a minute or two to kind of look that over. And if you're brave enough and want to throw your thoughts in the chat, please do so. This is a safe space. There are no wrong answers. Oh, somebody in the chat knows it. All right, don't say it. All right. I'll pull up the answer. Surgeon is the mother or second father. Around 40% of participants who are faced with this challenge do not think of the most plausible answer, being the surgeon is the boy's mother. Because we think that just because of held bias, we automatically think surgeon is male. So then we start to get into, and thank you for putting that in the chat, or a second father. Even she wasn't too sure about what was going on, because it's really fascinating. And around 40% of people that get that question just automatically don't think that's the most plausible answer, that it must be. And usually people get like really elaborate into their responses here, like rather readers invent elaborate stories such as the boy was adopted and the surgeon was his natural father, or the father was in the car was a priest and not his like father. And as such, it's just kind of wild, because it really illustrates the powerful pull of automatic stereotype associations. For some individuals, the association between surgeon and men is so strong that it interferes with their problem solving and making accurate judgments. So it's just kind of wild to think that. And I when I found this exercise, I thought it was fascinating myself. And I recently had an experience. Someone on Facebook had it posted, another female who just earned her PhD from the same program that I went through a couple of years ago. And she had a little story posted about how she told her son that, she's a doctor now and he can call her, just doctor, whatever it was. And he looked at her and was like, "You don't look like a doctor." And then she told her class, she's a teacher, told her class that she's, they can call her doctor, whatever. And the one little girl spoke up and said, "You look more like a nurse, not a doctor." So when we think about, even little ones can start to, get that messaging that doctor is typically a male and nurses are typically female. So how could, someone be called doctor? So anyway, kind of plays into this whole exercise. I think it's a great exercise. And again, not to make anybody feel bad. Again, we all have these automatic stereotype associations, but we do this work so we can learn to do better. All right, so let's look at some real world examples of these are racial microaggression examples. Okay. So a white man or woman clutches their purse or checks their wallet as a Black or Latino man approaches or passes them. What's the hidden message there? What does that indicate? Yeah, that they're afraid of them. Yep. Whether they're likely to get robbed. Yep. The man's a criminal. Yep. So the hidden message is, you or your group are criminals. Let's look at another one. An Asian American born and raised in the United States is complimented for speaking good English. What's the hidden message there? Yeah, definitely a microaggression. Yeah, that Asian people can't speak good English. Yep, that you are not a true American, you're a perpetual foreigner, even in your own country. Let's look at another one. A Black couple is seated at a table in the restaurant next to the kitchen, despite there being other empty and more desirable tables located towards the front. What's the hidden message there? Not worthy enough. Yeah. You are a second-class citizen and undeserving of first-class treatment. Yeah, they're not valued. Yep, absolutely. All right, let's look at a few. Let's look at some gender ones. A female physician wearing a stethoscope is mistaken as a nurse. We just talked about something related to this. So what's the message there? Yeah, a woman can't be the doctor. Yep, awesome. Women should occupy nurturing and not decision-making roles. Women are less capable than men. Yep, all the time. Also happens in reverse. Male nurses are assumed to be doctors. Absolutely. Very good. Yep. Whistles or cat calls are heard from men as a woman walks down the street. What's the hidden message there? Yep. Objectifying. No respect. Absolutely. Hidden message, or your body and your appearance are for the enjoyment of men. You're an object. Yep. Or assault. Yeah. It's assaultable. An assertive female manager is labeled as a witch, while her male counterpart is described as a forceful leader. What do we got there? Yep. Double standard. Yeah, women shouldn't be, shouldn't speak up. Women should be passive and allow men to be the decision makers. Yeah. All right, let's look at a couple more. And as you start to, look at these, you'll start to see them more. The more you do this work and review some of these, I notice, at least, I start to then even see them more, like in everyday life. So let's look at some sexual orientation ones. A person uses the term gay to describe a movie that she didn't like. What's the message there? Yeah, that gay is bad or substandard. Yep. Being gay is associated with negative or undesirable characteristics. Let's look at another one. Two gay men hold hands in public and are told not to flaunt their sexuality. What's the message there? Again, double standard. Yeah. They aren't acceptable. The same sex displays of affection are abnormal or offensive. Keep it private and to yourselves. Absolutely. All right. Nice job. And these are some more. This was actually from a study. I forget what college or university did this particular study, but they did this whole beautiful series of images, and that they were all different students and the microaggressions they had experienced on campus. So here's one here, this young person holding the sign where someone's saying to them, no, where are you really from? Or this gentleman, you don't act like a normal Black person, you know. Or this third one here, just because I'm Mexican, that doesn't mean I should be the automatic first choice for the role of Dora the Explorer in the high school play. So like, what are you? When people think it's weird that I listen to Carrie Underwood. And the last one I'll share. So what does your hair look like today? She said as she pulled off my hat without my permission. So again, not necessarily intended to cause harm, but when we see these here, like so isolated, it's obvious to us, like, oh my God, how could somebody do that? But you know, these things happen all the time, and so much work is being done in this arena, which is awesome. In my school in particular, we've been part of a professional learning community, all the administrators all year around these topics, which has been really awesome. And there's just been a lot of great work. That Dora the Explorer example just reminded me of a lot of work. I'm big into Broadway, is in the inspiration behind my business name, Dr. MC Self-Care Cabaret. But, you know, there's been a lot of talk in the theater world too about casting and, you know, not being more open to the casting and making sure that you're casting, you know, people of color in roles that were written for people of color, and not doing productions if you can't cast the roles as they were supposed to be, as they were intended, and all of that. So I mean, there is a lot of work happening in this arena, which is really exciting to see, but we still have a long ways to go. So we're going to do another activity together. This one's fun too. All right, so this is a self-awareness exercise that draws attention to similarities and differences in your close circle of influence, the impact on how you experience the world, and how unconscious bias may be formed. Okay, so I want you to grab, if you have a piece of paper handy or need to grab a little notebook or something, go ahead, but I want you to quickly list the 10 most influential people in your lives. Those people you count on for advice and guidance. So don't think too much about it. Just think who's like the first 10 people you would go to for advice or guidance. I'll give you a minute or so to wrap this up. All right. Did we write down our people? Okay. Your next step, consider the following traits for the 10 people you listed. And I want you to just make a little notation next to each person. And I'm going to read off the traits. So the first trait is marital status. So run through your list and just make a note. Are they single, married, divorced, whatever? Now I want you to consider race. just make a little notation next to each of your 10 people of what their race is. Their gender identity. Make a little notation there next to your 10 people. What is their gender identity? Their sexual orientation. Their age. Their ability or disability. Their class, socioeconomic status. Their first language. And lastly, their ethnicity. All right, we had time to make all those notations next to our 10 most influential people. So now we're going to discuss and reflect. What did you notice that surprised you about your circle of influence? How much diversity is there? Is there any? Again, not to make anybody, this isn't to make you feel bad if there isn't any diversity there. I know that, again, this is why we do, why we make sure we're taking care of ourselves through this process, is this can be difficult to recognize. Yeah, in the chat, thank you very much. Not a lot. If your group contains similar traits, how does that impact your life in a positive way? Yeah. And I say, yeah, some, but not a lot. So how does this impact your life in a positive way? And surround myself with positive people. Yeah. Okay. It's comforting, maybe. My computer's trying to do an update right now, which it can't do. So sorry about the beep. How does this impact your life in a negative way? Let's really think about your circle of people. Does it impact you in a negative way if your group contains all similar traits? Might narrow my options or options and advice. Yeah. Just gives you a narrow scope, right? Gives you a pretty kind of narrow view of things. It's pretty much similar, very similar perspectives. It's worth thinking about when you think about the people that you surround yourselves with. And the last, if your group contains a diversity of traits, so maybe you had a really diverse group, how does that impact your life in a positive way? Yeah, learning about different cultures. Yeah, and different perspectives, different lived experiences. We sometimes get so like locked into our own little bubble and our own little communities that we don't realize there's a whole other world out there. So outside our community, our little narrow scope of the world. Breadth of knowledge and experience. Yeah, very good. So if your group contained a diversity of traits, how does that impact your life in a negative way? Any thoughts about that? It could be misunderstandings. Okay. Sure. Feeling out of place. Yeah. Yeah. It's interesting to think about, right? When we just think about our circles and like the people we go to first. And what does that say about how we view the world? Work to navigate areas of difference from you. Yeah. I love learning about different lived experiences and cultures. I think it's cool. But there, a lot of us tend to though have narrower scopes. So what questions or feelings does this bring up for you? Anybody want to share? Were you surprised? Were you what did you notice? Yeah, seeing how different but how similar we all are. Mm-hmm. Yeah. It's interesting to think about. Sit with that for a little bit, and you don't have to share right now, but keep that in mind as you think about the people you spend your time with and what that looks like and why. All right. We're going to do another breathing exercise. And this time, we're just going to do some basic deep breathing. That exercise and some of these exercises we've done and some of the imagery we've seen, I recognize can be challenging. So we do want to make sure we're caring for ourselves throughout this process. So what you're going to do now, just going to do some basic deep breathing. In through the nose, out through the mouth. Again, pro tip, exhale longer than inhale. Okay, so I invite you to sit up again in your chair. You can close your eyes or lower your gaze. If it feels good, I invite you to place a hand on your chest. If that doesn't feel good to you, maybe figure out where it does feel good. Maybe you just want your hands on your lap or maybe you want your hands on your cheeks, or maybe your hands on your belly. Whatever it is, I give you one example, but if you want to do it differently, please do what feels good. So a hand on your chest and a hand on your belly is how I like to do it. Again, we're going to close our eyes or lower your gaze, and let's breathe in through the nose. Let's fill the belly all the way. You want to fill that belly full of air and a nice long exhale. And really empty that belly all the way on the exhale. And let's breathe in through the nose again. And a long exhale. And let's do that one more time. In through the nose. And a long exhale. Great. And when you're ready, you have your eyes closed, you can blink your eyes open or lift your gaze. Yeah. Quick breathing like that is one of the most underutilized, quick, efficient, free way that you can almost immediately bring a sense of calm into your life and whatever it is you're doing. So we're going to talk a little bit about, and I don't know if everyone here on the call tonight is works in education, but I did want to talk about how this looks in schools. And if you don't work in education, maybe you work somewhere that's relatable, you work as maybe a helping professional or in another setting with children, or even, you know, wherever you work, we can kind of adapt some of these things and see how they would show up in any workplace, really. Yeah, so we're going to look at these, but we are looking at them from a bit of a school perspective. So failing to pronounce or continuing to mispronounce the name of a student after they've corrected you. We can also see that could be, you know, a colleague in any workplace or someone that you meet or interact with. Scheduling tests or project due dates on religious or cultural holidays. Disregarding religious traditions or their details, so perhaps the impacts of fasting. Setting low expectations for students from particular groups or even neighborhoods. Calling on, engaging, and validating one gender, class, or race of students while ignoring other students during class. And again, we can see that could happen in a workplace environment also. Or assigning students tasks or roles that reinforce particular gender roles or don't allow all students flexibility across roles and responses. Anticipating students' emotional responses based on gender, sexual orientation, race, or ethnicity. I'll never forget in high school one time I had a teacher, freshman year math. Math was never my thing, but there was a very athletic female classmate, and this teacher happened to be the football coach or whatever. And he didn't believe she could do push-ups, the female student, and actually made her do them in front of the class. I think that was a bit of a microaggression, assuming that. I just kind of had that memory as I read that last example there. So there's a few more. Using inappropriate humor in class that degrades students from different groups. That can also, we can see that in any setting really, with colleagues and whatnot. Expressing racially charged political opinions in class, assuming that the targets of those opinions do not exist in the class. Using the term illegals to reference undocumented students, or hosting debates in class that place students from one group may represent a minority opinion in class in a difficult position. So singling students out in class because of their backgrounds, expecting students of any particular group to represent the perspectives of others, of their race, gender, etc., in class discussions or debates, or denying the experiences of students by questioning the credibility and validity of their stories. So it's a lot when we start to think about all the ways this can show up. And again, remembering that the harm is not intended, but the impact is very real. So when we think about microaggressions, the impact is much more than just some maybe hurt feelings. So this can cause anxiety in the other person, the victim of the microaggression and the bias, or depressive symptoms, lower self-esteem, increased stress response, undermine their trust. It can even, health issues, disengagement, lower feelings of belonging. We know belonging is the number one need. We talked about that in the beginning. Lack of confidence, poor performance, even dropping out of school, increased trauma, death by 1,000 paper cuts. I saw that. I read a beautiful story about how the impact of microaggressions, just that continual kind of grading and experience of experiencing them, feeling like death by 1,000 paper cuts, an increase of suicide risk, and just generally feeling unsafe. So we want to be, really careful about this, the conversations, what we say, and even if we're trying to be complimentary, even if we're trying, it's coming from a place of not intending to cause harm, we have to be very mindful of this. But again, in order to be able to do this work, you have to be able to recognize it in yourself. And you can't do that if you're really stressed out, and when you're burnt out, when you're exhausted, when you're just not taking care of yourself. We think back to that earlier quote. In order to be able to do this work, it needs mindfulness and self-regulation, and just having an awareness of how automatic this can be, how deeply rooted this can be, and the willingness to do better. So what can we do? What else can we do? So these are some examples. And again, these are more school-based examples, but we can think about how to shift those to other settings if you're not working in a school. All right. So recognize and reflect on your own biases, interactions, and behaviors. Again, it's important to do this work. It's what we're doing tonight. Starting to just scratch the surface of this. Understand a general definition of microaggressions. We've also done that this evening. Consider the various ways that they might manifest themselves and the impact they'll have on everyone in the learning environment or the workplace. Understand intent versus impact. That good intentions can still have harmful impacts. And understand your own triggers and unpack them. What makes you uncomfortable when we start to talk about these things? Why? And how can you work with and through this discomfort? In the beginning, focus on collaboratively establishing classroom norms and discussion for dialogue. So again, this would be if you were in a classroom setting. So if or when a microaggression occurs in a setting, here's some steps you can consider. Acknowledge the moment and immediately take the lead in addressing the situation. Either slow down or stop the conversation. Breathe, pause, and remember to stay as calm as possible. Return to your class norms, hold everyone accountable for their actions and ask for clarification. Explain why the incident is problematic and support the students in critical reflection on the situation. Acknowledge the emotions in the room, both visible and invisible, and ask the students if they would like to stay in class or if they need to take a break. While acknowledging the impact, make sure to validate and support those who have been targeted, and follow up as needed. So maybe next class this gets revisited, or you see the individuals after class and identify other people as sources of support. So things to avoid when intervening. So microaggression occurs. These are things not to do. Take a passive approach and letting the class direct the discussion. Again, we want to stop it. Disengaging from the conversation by accepting superficial responses or just dismissing it altogether. It should be talked about. Respond with hostility. We don't want to do that. Look to marginalized students or instructors to be experts on the issues relating to the identity group. Give your full attention to the perpetrator while ignoring the target of the microaggression. Focusing on or allowing a focus on debates about the intent of the microaggressor, what each person said or did, who's right or wrong. So that's what we want to think about, not doing in these situations. And this is even, if you're out in the world and you can, you hear something happen or you experience something or something said. I've had situations, I've been out with friends and, somebody else maybe says something, stopping it in the moment or just saying, that's not appropriate, or even things being said to me directly. I'm almost all Italian, and sometimes people think that's okay to maybe use inappropriate language towards me as if we're like pals or something. I don't know. It's weird when it happens, but it's like, how do you know that's not really offensive to me that you just said that? So, kind of calling it out in the moment, then talk back to, the person that just did that. Usually when you say something like that, because they didn't intend to cause the harm. They would either, maybe they're trying to be playful, they're trying to be funny, trying to be cool, whatever it is, even complimentary, but no. One of my favorite examples too, this was a couple of years ago. I was in the nail salon and it was around Christmas time. And I was over, getting my nails done or whatever. And there are a lot of Asian women in the nail salon. And there was an older white woman getting ready to leave. She had just finished, getting whatever she was getting done. And she was getting ready to leave the salon. And she said to the nail technician, who happened to be Asian, and said to her, "Oh, Merry Christmas. Oh, wait. I can't say that to you. Merry Buddha." And then proceeded to walk out of the nail salon. I was like, what just happened? Oh my goodness. I mean, people just, in that moment, I don't think she intended to be, rude, but that's certainly how it came across. And then she could have just said Merry Christmas and just left it at that and left. I mean, she said she had to make it a big deal by then saying, "Oh, I can't say that to you," and then trying to come up with something better in the moment. I don't know. It was very weird. But anyway, I mean, people do these things. And I mean, I'm sure we can think about other experiences I've had experiences, maybe being in a store, with age discrimination or age microaggressions. One time years ago, I was in a really fancy store in Boston, and I was a college student at the time, undergrad, and I was trying to buy my mom this little pin for Christmas or Mother's Day or something. And I went in there and I looked like a college student. I had on like whatever, probably, track pants and a hoodie and my backpack. And I just wanted to buy my mom this pin. I had the money for it. It was not an issue. I could not get a salesperson to help me because they would just, they've looked at me like, what's this kid doing in here? And actually, there was a white man that came in after me that immediately got helped. And I noticed that happened and I didn't like it. And I did speak up even then and was like, "Excuse me, I've actually been waiting here and I just want to buy this pin for my mom. And I don't know why I can't get any help from people." I didn't understand then exactly what I was experiencing. I understand it now. Why, and obviously, soon after I kind of understood it, but it was very much, I didn't look like their typical customer. So they weren't interested in really dealing with me, even though it was a sale right there for them. But anyway, I don't think they intended necessarily to cause harm or to do that, but it's exactly what when it happened. And I vowed never to shop in that store again. And I never will either. So if we start to think about our own lived experiences, and if folks want to share other examples that they have, I'd love to hear them. You don't have to, but you start to think about these things, and I'm sure we can all come up with examples that we've experienced. Excellent. All right. Oh, I've had some interesting ones with a Polish last name. Yeah, I bet. Yeah, wild. People are wild. I was even just thinking too, my mom lives in a larger body. She's a heavyset woman, and she, years ago, when she was going back to school to earn her degree at Salem State University, she wanted to become a teacher. It was always, her goal. And she went back to school at 39 years old. And she, her principal at the time, she was working as a secretary at a school while she was going back to earn her degree teaching. And she actually had the principal that she worked for said to her that, I don't think I'd hire an overweight teacher like you. Like, I think she thought that was helpful. I'm not really sure what she thought in that moment, but that was very, very hurtful to my mother, obviously. And, my mother usually jokes and says, well, I found a heavyset man to hire me, because she did get hired right out of grad school, right out of undergrad, an incredibly talented, dedicated, passionate teacher, and had a wonderful teaching career. She just retired after 20 years in the classroom last year, but she had that experience that really, like, ouch, like, why would you say that to someone? My goodness. I see a couple more things in the chat. Yeah, car shopping. Yep, I feel your pain there. Women are not really treated well, or when getting service. Yep, absolutely. Yeah. Oh, dealing with contractors. Yep, that's another one for sure. So they just automatically assume like you're stupid or you don't know what you're getting into. And yeah, crazy. I will say too, I was thinking about this. One of the best classes I ever took on this was during my master's degree at Salem State. And it was the multicultural class that was part of the master's degree in school counseling. And it was just eye-opening. I loved every minute of it. I had a custodian at a school tell me I should replace some Velcro I had put on the wall every month. Time it with you, period. Insert shock emoji. Oh my goodness. Crazy. I had that convo with my husband the other day. We're looking for a contractor now, and I told him that he might need to take the lead. Crazy. Makes me nuts. That's the one I like to step in and like fight. My husband will actually kind of step aside, and he's like, no, she's got this. It's like, he likes that. Taking care of it, taking care of business. Yeah. And on the reference sheet, I'm going to share with you some other articles and books that I think are really, really great and really important for you to read. And actually, it just reminded me, the one that I share is, one of the ones that I share is Peggy McIntosh, Unpacking the Invisible Knapsack. If you've never read that, I'll share the link on the reference sheet. I first read that in Dr. Mary Nee's multiculturalism class as part of my master's degree at Salem State, and it has never left me. It was so impactful. And that was about 12 years ago at this point. And I remember it vividly and still share it to this day. So yeah, it's a lot of work to be done here, but we're getting there. So let's just come back together here. Oh, my dentist told me I should take care of my teeth because you have a pretty face. It would be a shame to have bad teeth. Oh my goodness. You do have a pretty face, but I think your teeth are beautiful too. My goodness. Yeah. Unbelievable. On that note, let's release some tension. So we're gonna sit up in our chairs again. Just be here in this moment. Let all of this just kind of melt away as we feel our feet firmly planted on the ground beneath you, your body supported by the chair that you're in. And I want you just to lower one ear, your shoulder. And come back to center and drop to the other side. We tend to hold a lot of tension in our body. Good way to release it. I want to look down at the ground. And up to the sky. If it feels good, you can do some neck circles. I like to only do half circles. A little gentler than a full circle. Come back up to center. Let's look over one shoulder. And to the opposite side. Back to center. Let's roll our shoulders a couple of times. In one direction and a couple of times in the other direction. Great. Let's take our hands and clasp our hands together and gently roll out your wrists and make like figure eights with your wrist. And then try to reverse the direction, which is going to feel super awkward. One way is really easy to do and the other way feels really weird. And then you're going to take your palms and push them towards your computer screen and stretch your arms forward. Really get into that shoulder area. So going to shake out our hands and let that go. See where else are you feeling any tension? If you need to maybe do that again or move your body, maybe roll your ankles around. I give you permission to do that. Release your jaw. Release the tension in your forehead. We tend to hold all of our tension here. Great. Nice. All right. So as we wrap up here this evening, let's just reflect on all that we've talked about. So why is it important to you to explore your own implicit bias? Why does this matter? Does it matter? Because I don't want to intentionally or unintentionally hurt or target someone. Yeah. As a social worker, I believe it is imperative. Sure. Yeah. How is it connected to the work you do? Professionally important to build and maintain relationships with colleagues. Yeah. So is it connected to the work that you do? If you work in a, whatever it is you do, maybe you work in a school, maybe you don't. Does this make a difference? Yeah, I agree. I believe it matters everywhere. I believe you are correct. Yeah, how might exploring this, your own implicit bias, help you personally and professionally? Help us build relationships, help us just see other people, As a school-based PT, I work a lot to help others recognize their biases against kids with disabilities, and leading by example is so important. Yes. Beautiful. Help myself and others to learn about these things. Yeah. One of my crusades is really helping against fat phobia, and which exists in a lot of our culture and in a lot of our systems in the world. And not just because of my mom's experience that I shared, a few minutes back, but also my own experience, especially at the doctor's office. You go there and maybe there's not, or even anywhere, if I go somewhere and there's not a chair that I can sit in that's comfortable, because I too live in a larger body. I speak up. It's hard. It took a long time to get to this point. And I don't speak up necessarily, in a like screaming lunatic sort of way, but I will say, like, hey, is there any chance, there's a chair without, maybe a chair without arms, or there's another chair, I can't sit in this chair. And actually one of my doctor's offices, when I have to go back in a couple of weeks, they do not have a chair I can sit in. And I've said something to them. And if there's not a chair when I have to go back in a few weeks, I will say again, this has to change, because you always want to make sure you're a voice for people who don't have that ability to speak up. So if you feel you can be a voice and you can help, and I can see in the chat with some of the comments here that we want to make sure, we're leading by example, that we'll be a voice for those who can't. Absolutely. Thank you. Someone in the chat, good for you. Ooh, I'm getting a little emotional with that one, because yeah, it's hard, but we have to do better. And when you know better, you do better. All right. Self-care, my goodness, my favorite thing in the whole world. All right, we're just going to talk very briefly about this, because we've kind of pinpointed a few things. You have to care for yourself in order to be able to care for others. You can't do this work if you're not taking care of yourself. It's hard, and you need to be able to come at it from a place of calm. So what is self-care? This is what I mean when I say self-care. The daily process, foundational work required. It's not a would be nice. It's not a, oh, when I have time. It's not something I do when, on the summer vacation or during school break. Like, no, this is your foundation. So you show up as the best you possible. It's protective by preventing the onset of mental health symptoms, job and school burnout, and improving your lives all around. It's really, really important. I'm going to give a very, very brief overview of the 10 domains of self-care. This is not mani-pedis and a bubble bath occasionally, or like a yoga class once every 6 to 8 months. Like, that's not it. And again, the earlier sessions in this 4-part series, we really talked about this a lot more in sessions 1 and 2. We really dove in here, and this is a big part of the work that I do. So we need to, when we think about our self-care routines, we really need to look at how we feed ourselves. And are we doing that from a place of love or from a place of restriction? Are we listening to our body and honoring our hunger cues and our fullness cues? Are we hydrating? We need these things. You feel so much better when you're properly hydrated. It's astounding. We also need to move. You got to move your body. You can't just, sit in for long periods of time. Someone said to me recently, sitting is the new smoking. Ugh, I don't even like saying that. You got to move. But the good news is it can be fun, and it should be joyful. Re-engage with what feels good in your body. We also want to engage in soothing strategies. Maybe that's some deep breathing, or maybe that is yoga for you, or maybe listening to white noise, or having different scents around to help support you and soothe you. It's also our self-awareness and our mindfulness, how we make sure we're staying in the present moment and we're not all crazed and up here, and that we're grounded in the work that we do, so that we can be the best version of ourselves. How we rest. Did you know when you wake up in the morning, you should feel rested and restored? Not like you have to chug a gallon and a half of coffee before you can talk to anyone. You have to rest 7 to 9 hours a night. And then other things that are joyful and restful throughout the day are good also. Relationships. We want to make sure we're surrounding ourselves and spending time with people who are good to us, who sustain us, support us, encourage us, believe in us. Physical, medical. It's important that you engage in your physical medical care. You go to the doctor. You go to the dentist. You advocate for yourself when you're there, but you go. Also, our environment, how we maintain our space. Is it cluttered and chaotic and disorganized? Because that's really confusing to your brain when your spaces are like that. So how do we maintain our physical spaces? Our self-compassion. How do you talk to yourself and about yourself? Is it judgmental and critical and harsh, or is it from a place of love and compassion? In the spiritual domain, and this is where we want to see a bigger meaning for ourselves in the work that we do. If you happen to be an educator, typically you do really well in this domain because we see how important our work is. We work with children in any way, or mental health professional, maybe we know why we do the work that we do. And that we spend time in spiritual places, whatever that means for you, and that you engage in things that inspire you. That is a very, very quick overview of the 10 domains of self-care. If you want to learn more, I encourage you to follow me on social media, listen to my podcast, read my blog. We'll talk about where you can find all those places in a moment, or listen to the other previously recorded sessions in this 4-part series, because it's really, really important. You're worth it. Your health and well-being is worth it, and you'll be better because of it. So again, if you'd like to, we are going to end with a really nice guided meditation. But before we do that, if you'd like to visit the website, drmcselfcare.com/resources, I will get the resource sheet out to you probably tomorrow or over the weekend. It doesn't happen automatically, but I will send that to you if you are interested in it. And lastly, these are all the places you can find me. So I do have, again, a blog, a social media presence on Instagram, Facebook, my podcast posts to YouTube. I'm all over the place. And I do this work mostly on self-care, also trauma-sensitive education, growth mindset, and this presentation you had tonight. Yeah, you're very welcome. And I love this guided meditation, so don't jump off just yet. It is a really beautiful guided meditation that helps us to take wise action, which I love. So if you wouldn't mind indulging me for another 10 minutes or so, we will do this meditation. And thank you, Tammy. Tammy's one of my Tammy's done, I think, all 4 parts of the series and some other workshops with me, which is awesome. She keeps showing up, so she must like something. Just kidding. I know she likes it a lot. And the podcast, thank you very much. Officially a groupie. Yes, you are, for sure. And I love it. I love it so much. Yeah, the podcast is available on all major platforms. So anywhere you like to listen to podcasts, and it's conversations about self-care, and it's with other educational experts, healers, friends, people that I just think are cool and want to talk to them about different topics and talk about self-care, because everybody needs it. So awesome. And I do, this is just a friendly plug for the future. I'm also in the process of developing a program for youth, a high school program that is centered around self-care and mental health, and really helping kiddos navigate some of the challenges that we're seeing right now in mental health, the mental health crisis really that we're in. Yeah, so let's do a guided meditation. So this is a foundational awareness practice designed to help bring about 3 key insights: clarity of intention, understanding of our power, presence, and impact, and opportunities for wise action taking. If we take a moment to consider how complex, volatile, and uncertain current societal conditions are, as well as the spectrum of emotions we are feeling individually and collectively, it is easy to feel a sense of overwhelm and confusion about how we engage with the world from a place of strength, groundedness, and calm. In this meditation, I did not write this. This comes from Mindful Magazine, shared this, and I just thought it was beautiful. So I'm sharing it with you tonight. So I invite you to sit up in your chair again or get comfortable wherever you are. Let's feel your feet firmly planted on the ground and your body supported by whatever chair you're sitting on. In this practice, we will move through the 4 stages of human bridge building. We'll explore how we show up in each of the 4 transformative quadrants of self, family, community, and organizations. The breath we focus on is the normal flow of the in and out breath, allowing it to rest in its natural rhythm and cadence as we meet what arises with self-compassion and curiosity. To begin, silently set an intention for yourself to be open and curious about what comes up, receiving what comes up with equanimity. You may sit or stand comfortably, just allowing whichever position you choose to let you feel both alert and relaxed. Feel free to close your eyes or cast them in a softened downward gaze. Next, let's take 3 deep breaths in and out, allowing your mind to settle, your body to settle, and your breath to settle into its natural rhythm. Breathing in and out as we explore how we build bridges with others to serve as agents of transformation. We'll start with the self. First, let's bring our attention to our heart space by gently placing a hand over the heart, allowing it to simply rest there. Placing a hand over the heart can often bring us comfort when we explore difficult thoughts, emotions, and experiences. Next, see what you notice. Perhaps the weight of your palm against your chest, or a temperature difference in the space underneath your palm, or maybe even the sensation of each heartbeat as you expand your awareness, taking it all in with a gentle inhale and exhale. Over the next few moments, I invite you to consider these 3 things. How did I show up in the world today? How did my privilege show up through me? What actions can I take to help become more aware of my privilege and its impact on others? We don't have to know all the answers. We are simply inviting reflection and introspection to allow insights and awareness of the body and mind to arise. Whatever arises, see if you can meet it with self-compassion and curiosity. Family. Take 3 deep breaths in and out. Let us bring our attention back to our breath, allowing the mind and body to let go of the thoughts just reflected on for self-inquiry. Now let us consider the next quadrant of family. For many, family is where we learned our values, roles, and the lens through which we view life and others. With kindness and curiosity, I invite you to consider what key values you learned from your family and how they might impact your view of people who are not like you. If you like, you may continue to place your hand over your heart or return it to your heart to support you in reflection on ways your family experience has informed how you perceive the world. Focusing on the breath, notice any sensations in the body. Where are they? What do they feel like? If at any time this reflection becomes too difficult, please feel free to open your eyes if needed, pause, or stop to honor your self-care needs. Community. Bringing your attention back to the sensation of your breath, perhaps noticing the sound of your breath or the sensation of the body breathing as you let go of thoughts and reflections of family. If any difficult emotions remain, you may want to curl, squeeze, and then uncurl and stretch your fingers, allowing any tension to release with each stretch. Let's now turn our attention to community. Coming to awareness of privilege and the role of family in our perceptions of the world, we can now begin to see how we may be navigating the world and the quality of our presence in it, beginning with our communities. Now let's consider how we move through communities. With whom do you tend to interact with in your community? And with whom do you not interact? Why? Go deeper. Why? And now, for these next few moments, consider how you might show up differently in your community. Organizations. Let's bring our attention back to our breath as we let go of our thoughts about community, breathing in and out, in and out. In these last few moments, let us now turn our attention to the organization in which or with whom we work. At this point, we may have gleaned some insights about our privilege, the nature and impact of our presence, and how our families have shaped how we interact with and perceive the world and people around us. Bringing this forward, let's consider how these factors influence how we show up and work with our clients. See if you can notice where your lens of perception may need broadening or clarity. If there is a specific person or group of people that you hold with judgment and certainty, if so, bring them to mind and see if you can offer loving kindness to help you shift from judgment and certainty to discernment, kindness, and curiosity. What do you notice? What do you feel in your body? What stories or mental narratives arise when you think of this person or these people? What can you do differently to model and create a brave and safe space for all to flourish? Let us rest here for a few moments in contemplation. Taking 3 deep breaths in and out. Let go of the thoughts and bring your attention back to the sensation of your breath. As we close this meditation, I invite you to journal on what came up for you and what action steps you wish to take as you go about the remainder of your evening. When you're ready, you can blink your eyes open or lift your gaze. Come back to the moment. Thank you for allowing me to lead you through that. I hope you enjoyed it. That practice is based on the 4 stages of human bridge building as outlined in a book called A Bridge to Better, an open letter to humanity and resource guide. And I thought that is a beautiful meditation. So thank you again. And I hope you connect with me on other platforms. And I hope that you enjoyed our time together this evening. And I wish you well as you go out into the world and do great things. So thank you and good night. Happy to stay on if folks have any questions or comments or want to chat, whatever works. Thank you.